Taiwan, a very large and densely populated island off the southeast coast of China, between Philippines and Japan, has the highest incidence of CKD in the world. There are some well-known translational risk factors for CKD, including aging, high blood pressure, and diabetes. Less studied and less appreciated are environmental factors that may lead to kidney disease. Melamine, a chemical often used to manufacture heat-resistant, unbreakable tableware, is one culprit recently suspected of causing or exacerbating kidney disease in Taiwan. There is almost daily contact with melamine. Already, researchers have found that high concentrations of melamine greatly increase the risk of kidney stones in adults and kidney injury in children. Melamine may induce kidney tubular injury through oxidative stress and inflammation, leading to CKD progression. Our research team conducted a study of people with early CKD to investigate the relationship between urinary melamine levels and kidney outcomes. To do this, we enrolled patients with eGFR over 30 as early CKD group from CKD care program conducted at Kaohsiung Medical University Hospital in Taiwan between 2006 and 2010. At the time they were enrolled, we obtained urine sample and used ALC mouse mask to measure melamine level. We then followed kidney outcomes, including doubling of serum creatinine levels, eGFR decline over 3 mm/minute per 1.73 meter square per year, or a 30% decline in eGFR within the first 2 years. In total, we studied 293 subjects. The interquartile of urinary melamine level was 0.43 to 2.08 microgram per millimole. Over follow-up period of about 7 years, 80 subjects had doubling serum creatinine level, 34 developed end-stage kidney disease, 110 had eGFR decline over 3 ml per minute per 1.73 meter square per year, and 62 had a 30% decline in eGFR within the first 2 years. Subjects in the highest third urinary melamine level were at 2.3 times the risk of having double serum creatinine compared to those in the lowest third. Besides, subjects in the highest third urinary melamine level were at 2.1 and 2.5 times the risk of having eGFR decline over 3 per year and a 30% decline in eGFR in the first 2 years compared to those in the lowest third, respectively. We believe that environmental melamine exposure could potentially contribute to CKD progression. Therefore, physicians may want to educate their kidney patients about exposure to melamine in daily life, particularly with regard to the consumption of high acidic foods or very hard food cooked in microwave ovens, served in melamine plates and bowls, or eaten with melamine chopsticks.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.